You're listening to Body by Polly. I'm Dr. Elaine Polanese, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results. In this series, we're talking about possible complications after surgery, specifically plastic surgery, and in this case, the dreaded complication, bleeding. So, bleeding can occur after any surgery. So that's why during the surgery, of course, surgeons take meticulous care to cauterize every blood vessel, suture every vein and artery that we see so that when we're done with the surgery, it's completely dry and there's no bleeding. But especially in cases like plastic surgery, tummy tucks, or mommy makeovers, where we're really removing a lot of tissue, there's a lot of raw surface area, bleeding can occur. That's why we use drains. So if you've had a tummy tuck or a mommy makeover and you have drains, and the volume of the drains tripled overnight, that's a call. That's a call to your doctor. That's a call to 911 because that could indicate active bleeding. So why can that happen? I mentioned cauterization. So when we're doing surgery, we do cauterize blood vessels. That's electrocautery that basically imparts energy to the blood vessel and closes it off so that it stops bleeding. That's very effective, but after surgery in the recovery room or a day or two later, that little blood clot can pop off and the blood vessel can bleed again. So one of the things to notice is that if all of a sudden you have significantly more swelling on one side compared to the other, or if one drain is putting out a lot more fluid than the other, or bloody fluid, or if the drains are in the breast and one breast is double the size of the other, that could be a sign of active bleeding. It's also associated with very tight skin and a lot of pain and tension as well. So drains are important. Now, there are a lot of doctors that don't use drains, but I personally use them. I feel they're a great way to monitor what's going on. And as the drainage levels go down, you can really determine when it's appropriate time to remove them and when all bleeding has stopped or drainage has stopped. But bleeding can happen after surgery, and that's definitely something that you need to monitor. But typically, after the first 24 hours, that's when most of the risk of bleeding will stop. But it can happen even a day or two after surgery. So that's why close follow-ups are needed. And that's also why it's important to call your doctor if something happens like excess bleeding in the drains or swelling that's significantly more pronounced on one side than the other. That could be a sign of a hematoma or fluid or bloody accumulation under the skin. It can also cause the wounds or the incision lines to open up, and there can be bleeding from there. These are not very common things, but things to watch out for after any major surgery. So if you are experiencing bleeding, which means that if you have drainage tubes and you notice that they're putting out more and more, you have to empty them 2 or 3 times a day and they're filling up pretty quickly, that's a call. That's an immediate call to your doctor. Or if you can't reach them right away, call 911 and go to the ER because that's something that needs to be evaluated pretty quickly because active bleeding needs to be addressed in a timely fashion. Thanks for tuning in to Body by Polly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.